Hi everyone, welcome back to Ostomy Care with Angel Face Amy. I'm Amy, an ostomy certified nurse with over 10 years of experience, and today we're diving into a topic that's really important, preparing for ostomy surgery. If you're facing a colostomy, ileostomy, or urostomy, you might be feeling scared, overwhelmed, or even grieving the changes coming your way. That's totally normal, and you're not alone. In this video, I'm sharing 5 nurse-led tips to help you prepare physically and emotionally so you can face surgery with confidence and hope. Stick around to the end for a special call to action. And let's get started. So tip number 1, educate yourself about the procedure. So hopefully your surgeon has you meet with an ostomy certified nurse prior to your surgery. This meeting has 2 main purposes. 1, mark your abdomen for the placement of the ostomy with a surgical marker. So when they say that you need to go get marked, a lot of people want to know if this is going to get tattooed or what's happening. And it's literally just an opportunity for the ostomy nurse to look at your stomach in a sitting, sometimes lying back, and sometimes standing position. So that way we can make sure that we give the surgeon a good target of where to put the stoma. So we don't want to put it right at your pant line, and we don't want to put it in a crease or a divot. We want to make sure we stay away from old scars. So more or less, this is just an added benefit that the surgeon, he has just a target to aim for. It's always in the end up to the surgeon, but when you lay flat on an operating table, your abdomen looks smooth, and like any place on your abdomen looks like it would be a good place for an ostomy. But in reality, when you sit and you bend and you wear pants, there's obviously places that we want to avoid. So this is a sign of a good surgeon. If you're having an elective procedure and they send you to an ostomy nurse before the surgery to have this done, I think it's very important and helpful. But for another reason, number 2, it's also important because you can get all your questions answered and get an overview of what to expect. Knowledge is power, and understanding what's going to happen can really ease your fears. Ostomy surgery, whether it's a colostomy, ileostomy, or urostomy, creates a stoma, a small opening on your abdomen to help your body eliminate waste. It sounds intimidating, but knowing the basics can make it less scary. Your imagination is usually worse than reality, so getting all the facts and knowing what you're really in for is really helpful. As a nurse, I've seen patients feel so much better after asking questions like, how long will the surgery take? Or what will my stoma look like? It's really important to write down all your questions and bring them with you to your pre-op appointment. And like I said earlier, you can ask your surgeon or you can ask your ostomy nurse. Ask to meet with an ostomy nurse if they haven't suggested it. And that way you can get a lot of those answers and know what a bag is, what it looks like, actually see it before you have the surgery. The ostomy nurses are like your personal guide for this surgery. I remember a patient who was terrified before her ileostomy surgery, but after watching videos and talking to her nurse, she told me that she really felt like she could do this. You can find reliable sources online too, but it's easy to go down rabbit holes of misinformation and too much overwhelming information too online. So that's why it's important to find reliable people like an ostomy nurse to support you and answer all these questions. The more you know, the less the unknown controls you. Tip number 2, process grief with support. Facing ostomy surgery often brings up grief. Maybe you're grieving your health, your body image, or the lifestyle that you're used to. Those feelings are valid and you don't have to go through them alone. One of the best things you can do is connect with others who get it. Join an online support group like the United Ostomy Associations of America forums or search for ostomy communities on Facebook. Talking to someone who's been there can make a huge difference. You might also consider a counselor who specializes in chronic illness. They can help you work through fears or sadness. In my nursing practice, I had a patient who started journaling before his surgery. He wrote down his fears like worrying about leaks or feeling embarrassed. And over time, he said it helped him feel lighter, like he was letting go of some of that weight. Try writing down one thing each day you're feeling. It's a small step that can feel so powerful. And if you're already part of our community here, drop a comment below to connect with others. You'd be amazed at how supportive this group is. Moving on to tip number 3, prepare your body and your mind. Surgery is a big deal, so let's set you up for success. Physically, follow your surgeon's pre-op instructions to a T. This might mean a special diet like low-fiber foods a few days before, or staying hydrated. Yes, drink that water. A healthy body recovers faster. For your mind, try some simple techniques to stay calm. One of my favorites is visualization. Picture yourself after surgery healing well and getting back to all the things you love, like walking your dog or gardening. Another trick is affirmations. Try saying to yourself, "My body is adapting to keep me healthy." It sounds small, but it can shift your mindset. It truly is amazing how the human body can adapt. I had a patient who practiced deep breathing before her colostomy surgery, and she said it helped her feel in control when everything else felt uncertain. Start small and give yourself grace as you prepare. Tip number 4, plan your post-op recovery. A little prep now can make those first few weeks after surgery so much smoother. So for home, you're going to want to stock up on some essentials, maybe some medical gloves, some bed protectors, some washcloths, or some decent quality paper towels. And make sure you have some water or Gatorade-like drinks stocked up. Your ostomy nurse should send you home from the hospital with all the ostomy supplies that you will need, and then have samples mailed to your home as well. Next, set up your home for comfort. Arrange a cozy recovery spot with pillows, a side table for supplies, and maybe some Netflix or YouTube to keep you entertained. Ask a family member or a friend to help with chores or meals for the first week or 2. As a nurse, I always tell my patients recovery is a marathon, not a sprint. You might feel sore or emotional, and it's going to take time to get through this all, and that's okay. But planning ahead lets you focus on healing without stress. Oh, and it's also important to start with light movement like short walks as soon as your doctor approves it. This can help lift your spirits and help your body recover quicker as well. And for our last tip, tip number 5, build a support network. You don't have to face this journey alone, and connecting with others can make such a difference. Reach out to other ostomates online. Our comment section here is a great place to start. I love seeing you support each other. You can also find local support groups through hospitals or organizations like the United Ostomy Associations of America. Hearing someone else say, "I felt that way too," can be comforting. So I also heard this other story of a patient who joined a support group before his surgery, his urostomy surgery. And when he was at a meeting, he was listening to another ostomate, and he was talking about how he was able to go back to hiking after he had his surgery. And this gave the patient hope that he would be able to go back and do the things that he loved with his ostomy too. Your network might also include family, friends, or even your healthcare team. Tell them how they can support you. Maybe it's checking in with a call or helping with errands. Building that community reminds you that you're not defined by your ostomy. You're still you, and you've got people cheering you on. So there you have it. 5 nurse-led tips to prepare for ostomy surgery and ease fear and grief. Educate yourself, process grief with support, prepare your body and mind, plan for recovery, and build your support network. You're stronger than you know, and I'm rooting for you every step of the way. If this video helped you, give it a thumbs up and share it with someone who might need it. Your shares mean so much to our community. Drop a comment below. What's one thing you're nervous about before surgery? Or how have you coped with grief? I read every comment and love hearing from you. Don't forget to subscribe and hit the bell so you don't miss my next videos. Thanks for watching Ostomy Care with Angel Face Amy, and I'll see you next time. Take care.